Hello, everyone. My name is Claire Saladino, and I'm currently in Gonzaga's post-bac Evan Peta DNP program. I am entering my second year into the program and have been a nurse for 6 years now, working at one of Seattle's metro hospitals in the float pool. I have worked largely with the adult and older adult populations. However, being in the family nurse practitioner program, I acknowledge that I will be a provider for patients throughout the lifespan. This has motivated my efforts in pursuing this project proposal, particularly in pediatrics. In this informational speech, I am going to talk about the policies that I wish to analyze, the objectives of those policies, and the significance of my project proposal. The issue that I would like to tackle is in regards to the amount of screen time exposure children and adolescents have and what detrimental effects it can have on a child's social, emotional, cognitive, and physical development. Just a little background information. In 2002, the CDC stated that since the 1980s, the number of children in the U.S. who are physically active had decreased, while the number of children who are overweight has doubled. The amount of exposure on average a child spends in front of a screen in the early 2000s was 4.5 hours. The effects of sedentary behavior has been well documented since then and has sparked programs such as Michelle Obama's Let's Move campaign. Unfortunately, the daily average screen time exposure has slightly worsened over time. With new technological advances, the CDC claims that toddlers are exposed to more than the recommended 2 hours of screen time a day, and children ages to 8 to 18 are spending on average 6 hours a day in front of a screen using entertainment media. The American Academy of Pediatrics had put out 2 policy statements in October 2016 titled Media and Young Minds and Media Use in School-Age Children and Adolescents. The key elements of these policy statements explain the risk and benefits of screen time exposure on children's sleep patterns, academics, functioning, weight, social interactions, play, as well as parental relationships. However, it fails to prioritize the need to create public awareness of these negative effects and needs to reinforce stronger filters and safety measures on media content. With the threat of $1.2 billion in budget cuts towards the 21st Century Learning Center grant program, it is more imperative now than ever. This grant helps fund before and after school programs that also support exercise, safe play, and learning. Unfortunately, the economically disadvantaged will be the first to be affected. Both state and national levels need to be in support of the AAP's policy statements to guide stakeholders and policy decision makers. Action must be taken to ensure that the most vulnerable are protected and that systems are in place that can support it. My project proposal will focus on enhancing the AAP's guidelines to create stricter adherence within schools and at home by partnering with key stakeholders such as parents, educators, legislators, and providers, to name a few. Instead of creating a larger health gap, the state and the national governments need to ensure public policy is in support of enriching our nation's future. Thank you so much for listening. Bye.